Hi guys, I am camping, so this is my different background. There's Jason's pirate flag. I'm not really sure what that's about. We're not on the boat, we're in the camper. Anyway, but taking advantage of the fall weather, and we're up in Fort Payne at DeSoto. Has anybody been to DeSoto Park? So I was going to go live today, and my Wi-Fi is great, but for some reason there's a little bit of instability with the live, and so I don't want you guys to miss this. And there's so much conversation and chatter right now, and so I thought that I would touch base about it. And I'm going to give a lot of shout outs to my girl Tina Higgins over at Premier Hormone in Gulf Shores. Those of you that are patients of mine and clients, you know that I adore her, and I've been sending you over there to her. So anyway, so let's get started. So we're going to talk about the truth about hormones, menopause, and then the FDA's big shift that was just announced. So, hey friends, I'm Dr. Cindy, and if you are anywhere near perimenopause, menopause, or love a woman who is, so it's for you guys too, you're going to want to stay for this one. The FDA just did something that they haven't done in over 20 years, and I had my full hysterectomy, which put me in surgical menopause back 25 years ago. I was 21, 22 years old, and it was scary because there was no information out there. No one talked about hormones. My grandmother died of breast cancer, or so they say, and they didn't want to put me on any hormones because of my genetics. So for 10 years, I went without anything. Major bone loss, moods up and down, anxiety through the roof, night sweats, hot flashes, you name it, I went through it. It wasn't until I was 29 and I went to a Botox party that was being put on by Dr. Ruddles over in Fairhope, I think he was at the time. And a friend of mine talked me into it. Went over there, and he convinced me that hormones were like the best thing ever and educated me. That's all it's about. He educated me on what I was missing out and what they aren't telling you. So since I was 29 years old, I have been mostly on, off sometimes, of hormone replacement therapy. Look at all these little bugs up here that are distracting me. By the way, we're in our fifth wheel, and the dogs are happy. So that's all you guys need to know. So yeah, for the most part, I've been on, bounced back and forth between osteoporosis and osteopenia. And, it was just kind of one of those things. I knew that I needed to be on it, but there still just wasn't a lot of information out there, and there was a lot of scare tactics. So I'm going to talk a little bit more about that. So the FDA, they removed the big scary black box warnings from most hormone therapy for menopause. So they just did that this week. Those are the bold, fear-inducing labels that basically said, hey, this might cause heart attacks, strokes, dementia, cancer. Good luck. And so for most people, they were really scared, and they didn't take them, and they suffered, and we shouldn't have to. And overnight, an entire generation of women got scared away from something that, for many of them, could have actually improved their brain health, bone health, heart health, and quality of life. So today, I want to break this down in plain language. What actually changed, what estrogen, progesterone, and testosterone really do in your body, who might benefit from hormone therapy, where the real risks actually are, and how to have an empowered, intelligent conversation with your general practitioner or your OBGYN instead of a fear-based one. And again, guys, if you read something, there's a book that I just finished called How to Menopause. I think I talked about it last week. It's really good. Buy a copy. Take it to your doctor. Ask them to read it, because they may not have as much education on this as you guys think, especially with hormone replacement. I know a lot of people get the dosing wrong, and that causes a whole nother wheelhouse of side effects. So we just want to make sure we're doing everything right, and that's my job. Remember, I don't prescribe hormone replacement therapy. I'm here to educate you, and I work in collaboration with nutrition, supplements, of course, and to get your body back to a state of balance. And hormones are a big part of that balance. So I want you guys to stay until the end because I'm going to answer some of the questions that I've been getting all week long about HRT, and I'll have real life style question and answer. Okay, so definitely stay tuned for that. I got some good questions. So what just happened with the FDA? So let's start with the news. Back in the early 2000s, there was a big study called the Women's Health Initiative. You'll hear it called WHI. The women in this study were on average around 63, so more than a decade past typical menopause age, and they were put on older forms of hormones that we don't commonly use the same way anymore. The early headlines screamed, hormone therapy causes breast cancer, which is why I wasn't on them for like 8 years, heart attacks, and strokes. So the FDA slapped this big black box warning on most of your systemic hormone therapies for menopause. HRT use plummeted. Doctors got scared. Of course they got scared. They didn't want to lose their license. Women got scared. And for over 20 years, that fear has stuck. It's over, guys. It is over. It's an absolute game changer. So fast forward to now. The FDA and the HHS reanalyzed more current data, including younger women who started therapy closer to the onset of menopause. Expert panels reviewed the evidence, and they decided those broad, one-size-fits-all warnings about cardiovascular disease, breast cancer, and dementia were misleading and over-applied. Hallelujah. So what are they doing? They're removing the big black box warnings from menopausal hormone therapies. They're updating labels to be more nuanced, focusing on age, timing, type of hormone, and which route you take, patch, oral, vaginal, etc. Remember, it takes all the pieces of the pie, right? Like, just if you get on hormones and you don't do anything else as far as lifestyle, things may not change that much. But if you add it in as an enhancement, your world is going to absolutely change. So they're keeping a warning around endometrial cancer for women who take estrogen alone with an intact uterus, because unopposed estrogen can still overstimulate the uterine lining. So no, hormones did not suddenly become 100% safe for every single person. What changed is the messaging, from blanket fear to all of them, to a more personalized risk benefit. That's why I always say, you cannot manage what you're not measuring. Get your labs done. Every plan that I do is individualized. There is no one size fits all. So how did we got stuck in 20 years of fear? So let's talk about the fallout. For 2 decades, women were told, be scared of hormones. Tough it out. This is just part of aging. Have you been told that? I'm sure. I know that I have. So brain fog, anxiety, depression, weight redistribution, bone loss, night sweats, vaginal dryness. I had all of these. And a tanked libido got labeled as just you getting older, instead of what it actually was for many women, a hormone collapse. And what happens when we terrify people without educating them? Women suffer in silence. Doctors avoid conversations because they're afraid of liabilities. And we lose the opportunity for preventative and protective care. The FDA is now basically admitting, hey, we oversimplified this. The warning was based on older women, older drugs, and it didn't apply equally to everyone. That's why I always say, like, your conventional labs, the range is so broad and they're comparing you to everyone else your age that's sick. So, of course, the doctor's going to call you and be like, hey, Emily Sue, all your labs look great. We'll see you back here in a year. And you still feel like something's off. You're symptomatic. And it's because the ranges are so wide and they're not measuring for that individuality. And that's what we have to do here. So that's a big deal. It doesn't erase the last 20 years. But what this does is it opens the door for better conversations going forward. I always talk about hormones. Hormones are everything. Actually, when I first set out to do private practice, I was like, I'm only going to do hormones. But then realize that most people came to me for gut health, and then that led to everything else. So yeah, hormones are a huge piece of the pie. So what do these hormones actually do? All right, so let's go under the hood. I'm going to keep this in real life language and not textbook talk. Estrogen. It's not just your period hormone in midlife. It is a brain protector. It helps with memory, focus, and cognition. It's a bone protector. It helps prevent bone loss and osteoporosis. Believe me, I was so estrogen deficient. That's why I kept bouncing between osteoporosis and osteopenia in my hips and my lower back. It's also a vessel protector. It influences cholesterol, blood vessels, and nitric oxide, which all tie into heart health. A mood and energy supporter. Sorry. That steady, resilient feeling that you used to have, estrogen will get you back there. And when estrogen crashes, women don't just age. They can feel like a completely different person overnight. You wouldn't believe all the stories that I hear. Just like that, overnight, I felt like my whole world had changed. I'm sure if you're perimenopause or menopause, you can understand that. Progesterone. It is your calm the storm hormone, okay? It helps with sleep quality, especially staying asleep through the night. Stabilizes mood and can reduce that wired but tired anxiety. And it balances estrogen's effects on the uterine lining. Low progesterone can feel like racing thoughts, irritability, waking up at 2 to 3 a.m. and staring at the ceiling. Been there, done that. Feeling edgy and overstimulated. All right, let's talk about the big one. So I saw a post this week and it said, testosterone is not a male hormone, it's a human hormone. Exactly right. Testosterone is not just a male hormone. It's a human hormone, and in women, it supports muscle maintenance and strength, metabolism and body composition, your sex drive in life, motivation, sexual desire, pleasure, stronger pleasure, energy, confidence, and just that spark. And when testosterone is low, women often say, I feel flat. I don't care about things I used to care about. My muscles just disappeared. Your composition and your skin changes. No matter what you do, it's just not there anymore. So when we talk about hormone therapy and menopause, we're not talking about vanity. We're talking about brain health, bone health, muscle, mood, metabolic health, and quality of life. Okay. I'm going to take a breath. What the new guidance actually emphasizes. So here's the part that I really want you to hear. The updated FDA stance leans into the window of opportunity idea. The best time to consider systemic hormone therapy is usually within 10 years of menopause or before the age of 60, especially for low risk women. Why does timing matter? Starting hormones earlier, when blood vessels and metabolic health are still relatively resilient, appears to be safer and even more protective in some women. Starting for the first time much later, say mid-60s to 70s, it can be very different, especially if there's established cardiovascular disease. So the FDA is removing the broad, scary black box language about heart disease, stroke, and dementia from most menopausal hormone therapies. Still keeping information about the possible adverse effects in the fine print. It's just not screaming at you in the bold black box. Leaving a specific boxed warning for endometrial cancer and estrogen-only products used in women who still have uterus. My throat is dry. Other important nuances: type matters. Bioidentical estradiol and micronized progesterone behave differently than older synthetic formulations. Route matters. Like I inject. That's just my preference. I like it. I also have a cream. It's bioidentical and it has my estrogen in it, progesterone, and a little bit of testosterone. And I also inject testosterone. Patches, there's transdermal routes that may have different clotting and metabolic risk profiles than your higher dose oral estrogens. And then, of course, dosing and duration matters because they have a shelf life. And you just don't want to be up and down. I have so many women that come to me and they're like, I felt amazing at the beginning, and then it just disappeared and it went away and they felt like crap. So I microdose and I do it daily, but that is my preference. A lot of people do not want to inject themselves with a little needle every day. Just my preference. A lot of options. Tina over at Premier Hormone, she can absolutely help guide you with that. All right, benefits versus risk. Let's talk about the pros and cons like grown-ups. Potential benefits: in the right person at the right time. Relief of hot flashes and night sweats. Better sleep and mood. Preservation of bone density. Lower fracture risk. Possible cardiovascular and metabolic benefits in younger early menopause women. Better sexual comfort, lubrication, and libido. Improved quality of life and ability to function day to day. All right, here's some risk. Who needs the extra caution? Personal history of estrogen-dependent cancers, like breast cancer. History of blood clots, stroke. I'm going to make this. Or clotting disorders. Uncontrolled high blood pressure or advanced vascular disease. Untreated uterine issues if estrogen is given without progesterone in a woman who still has a uterus. The new FDA move doesn't say everyone run out and get hormones. It says that we need to stop scaring every woman equally and start making individualized decisions based on age, timing, health, history, type of hormone, and which route you take. So that is what's been happening, all right? So my role versus your prescriber's role. Remember, I do not prescribe hormone replacement therapy. I refer out, and one of my recommendations is Tina Higgins at Premier Hormone. Love her and Dr. Brown. They're amazing. So what I do is I help you understand the biology behind your symptoms. I help you understand your labs in a functional context. I help you optimize the things that amplify or sabotage hormone therapy, such as inflammation, blood sugar, gut health, sleep, nutrition, and toxic load and lifestyle. Hormones are just one piece of the puzzle, a powerful piece for many women, but they work best in a body that's supported in all these other areas. So my lane is educate, strategy, lifestyle, labs, supplements, and helping you walk into your hormone conversation with your provider feeling informed and not intimidated. If you're listening to this and thinking, oh my gosh, this explains everything I've been feeling, and you are not broken, you are not crazy, and you are not alone. So here's what I want you to do. 1, stop blaming yourself for having symptoms. Hormones shift. They shift. What works today may not work tomorrow. Just had the conversation with a new patient. Biology changes. That doesn't mean that you have to suffer. Start the conversation with a provider who actually understands midlife hormones. If you missed my menopause live, which I did not do, so this is recorded so you do not miss it, I am going to, I'll put this up on my YouTube. Also, I have a menopause PDF guide that will help walk you through some of the steps as well. And it is awesome, and it will give you the education and the confidence knowing when you walk in with your GP or your OBGYN, you're armed with the best information. So I will make sure that it is up, and it is on my website, lifewellnessforever.com. Just go to the storefront and you'll see it there. Remember, menopause should not steal your spark. It actually can be a season where you get more intentional, more powerful, and more aligned with your health than ever before. I'm thriving, literally best shape of my life, holding muscle. That's why I'm writing my 4th book on menopausal muscle, because I want women to know it doesn't matter if you're in menopause. You can live your best life. You can look your best. You can thrive. There is no reason that we should be actively dying for 2 to 3 decades before our expiration date. Okay? All right, so here's a couple questions. I know that I'm running over on time. So Sarah asked, if the black box is gone, does that mean that HRT is safe for everyone now? Great question, Sarah. No, it doesn't mean it's automatically safe for everyone. It means that the FDA recognizes the old warning was too broad. You still need a personalized risk assessment based on your age, family history, medical history, and type of therapy. It's about safety, smarter use, not universal use. Melissa says, I'm 52, in perimenopause, healthy, no major issues. Am I the kind of person that they're talking about when they say younger women benefit more? Yes, absolutely. That's exactly the group. A lot of the updated guidance is aimed at women in their 40s and 50s, close to menopause, without significant cardiovascular disease or major contradictions. That's often where the risk-benefit conversation tilts more favorably towards hormone therapy, especially if symptoms are impacting daily life. Jen asks, what if I have a family history of breast cancer? Does that automatically mean no hormones? Remember, I was there. So for almost 10 years, no hormones because my grandmother died of breast cancer. But Jen, family history is important. It's not automatic, never. Your provider should look at your specific risk, what type of breast cancer, who had it, what age, what are your genetics, lifestyle, and other risk factors. Some women with a family history still end up on a very carefully monitored individualized hormone therapy. That decision needs to be a conversation that they have with their hormone provider, and you guys navigate that together. So it's not a knee-jerk yes or no. Tasha asks, is bioidentical always better? Bioidentical means that the hormone molecule structurally matches what your body makes. So it matches what your body used to make. For many women, bioidentical estradiol and micronized progesterone have a more favorable safety and side effect profile compared to older synthetic versions, especially regarding clot risk and metabolic impact. But bioidentical is not a magic word. Dose, route, timing, and your personal health still matter. You still need a provider who knows what they're doing. Remember, it's not just a buzzword. All right, last question, and then I'll let you guys go today. I got to get back to hiking. Lauren asks, can I start hormones if I'm already 65 and never took them before? Lauren, that's where things get more cautious. Starting systemic hormone therapy for the first time later in life, especially if there's existing heart disease, may carry different risks than starting earlier. The updated guidance strongly emphasizes starting within 10 years of menopause or before 60 when possible. Past that, the conversation needs to be very individualized, and it might lean more towards local vaginal estrogen options or non-hormonal strategies, depending on the situation. All right, guys, thanks as always for tuning in and taking time. Again, this is recorded today because I did not want to lose signal, and it was a lot of information. I want to make sure you didn't lose it. You can reach out to me, Cindy, at drcindyross.com. Visit my website, lifewellnessforever.com. Happy to answer any questions. And if you're ready to get started, give me a call, 251-635-7477. See you guys soon.